I'm Edwin Stickney. I was born in Wisconsin, grew up in Minnesota, went to McAllister College, Presbyterian School, and then the University of Chicago Medical School, and interned at Minneapolis General Hospital, and then came out to Broadus, Montana. This was our home mission field, you might say. That's a town of 600 south of Miles City. We were there, we opened my practice August of 1955, and we were there for 5.5 years and then moved to Miles City, where we were for 37 years, and then came to Billings here in 98 and have been here ever since. I practiced about 13 months here in Billings and then retired. I ended up being active in the Academy of what used to be Academy of General Practice and now is the Academy of Family Physicians, and ended up being the president of the Montana chapter, and then went through the chairs in the Montana Medical Association, ending up in '86 being the president of the Montana Medical Association. I can't remember how I became active in terms of advocating for the use of medical marijuana and actually advocating for legalization of all drugs. To my mind, the place of government is not to put people in prisons, but to treat their problems. Humankind has always felt the need to ameliorate or lessen the pain of human existence, and so drugs are always going to be in our history. They have many good uses, and of course in excess they are always bad. My history as far as especially marijuana has been one of having a strong belief that marijuana has many uses, and I have given about, well, in the neighborhood of 200 recommendations to individuals which allow them to become medical marijuana patients. And the stories, when they would come back for a renewal after a year and to renew their card, the stories that they would bring of being on Percocet or other prescription narcotics and being able to either cut down markedly or else eliminate their use of narcotics completely because of their use of medical marijuana are overwhelmingly positive. It's been my recommendation that people by and large ingest, in other words with brownies or cookies or something like tinctures or whatever, rather than smoking, because instead of getting a peak and then a valley with only about, say, an hour and a half, 2 hours of effect, that if they ingest it, if they eat it instead, they get a much more flat, consistent level and eliminate the highs that give the objectionable side effects. And marijuana as a drug, as far as I know, and of course, unfortunately, the Drug Enforcement Administration and the federal government generally has been so restrictive and so against the use of marijuana that they have not allowed very much widespread legitimate research. And so it's hard to get research, but the research that is there, as far as I know, overwhelmingly indicates that marijuana is not a dangerous drug, that it has perhaps the addiction potential of caffeine, and that side effects generally are minimal, as compared with, say, alcoholic cirrhosis or the 400,000 deaths per year in this country from nicotine related respiratory illnesses. It is a far safer and in many ways much more effective drug. With alcohol, for instance, you get aggressivity, you get road rage. With marijuana, there's more of a mellowing out. So generally speaking, as far as I'm concerned, the whole business of drug prohibition, of the drug war that was proclaimed by Nixon in 1971, is the nation's major psychosis. It is really a sickness, in my opinion. And the sooner we legalize, regulate, and tax marijuana, treat those who misuse it, because there are going to be people who misuse it, just the same way as there are people who misuse any drugs, including especially alcohol and nicotine. The sooner we do that, the more healthy will be our economy, because there's billions of dollars to be gotten through taxation. And also probably 50% at least of the people who are incarcerated in our prisons are for nonviolent crimes. And these nonviolent, almost you could say, is equivalent to drug related. So it is a sickness, and the sooner we get rid of it, the better, as far as I'm concerned.